Ovarian cysts, ovarian cyst. They can be troublesome at times, not just because they cause you pain, but also because certain types of ovarian cysts can affect your fertility. Do you want to know all about ovarian cysts and what you can do to prevent them affecting your fertility? Keep watching. Hi, I'm Dr. Kady. This is HeyDoc. Welcome to this channel where we talk about all things to do with women's health, fertility medicine, and pregnancy related matters. If you like this type of content, do consider hitting the subscribe button. For those of you who are new, welcome. And for our returning subscribers, thank you for your love. Why don't we start by describing what ovarian cysts are? Ovarian cysts are fluid-filled sacs that occur on or inside the ovary. They are so common, and more often than not, they are harmless. But in some cases, they can affect your fertility and your overall reproductive health. These cysts can vary in size, so they can range from being quite small, almost microscopic, to being several centimeters wide. And earlier, I described ovarian cysts as fluid-filled sacs. But let's get a little bit more complicated for those of you who have stuck with the video so far. Yes, ovarian cysts are very often fluid-filled, but those ovarian cysts are known as simple ovarian cysts, where they just contain a little bit of fluid, often clear type of fluid, and these type of ovarian cysts very often resolve by themselves. However, you can have another type of ovarian cyst which can contain air. Sometimes it may contain blood, but at times certain ovarian cysts may contain semi-solid material. So there are two different groups of ovarian cysts. The first group is known as the functional cysts. These are the types of cysts that are very common and they're simple and harmless. Within this group, the type of cysts that exists include the follicular cysts. So we have the follicular cysts, and these type of cysts form when the egg that they contain do not get released during ovulation. These type of cysts will usually disappear by the end of that cycle. Then we have the corpus luteum cyst. Now, this is physiological. This is actually supposed to be there, and it's the remnant of the follicle that has just burst to release the egg. This corpus luteum will stick around in the first few days after ovulation has happened, and the purpose of the corpus luteum is to be able to support the fertilized egg that will soon be implanting, and then after it disappears. So we've talked about physiological cysts that happen in every menstrual cycle for those who are ovulating regularly. Let's look at the second group. And these are the pathological cysts. These ones do not occur in every woman. So unlike the first group, most women will have these physiological cysts. These pathological cysts, if you have them, there is a problem. So they tend to be less common and are the ones that are going to affect your fertility and very often can be painful. Within this group, we have the endometriomas, also known as the chocolate cysts, and these are caused by endometriosis.